is a problem. It affects the body, and it has its effects on the hip, and it has its effects on the low back. And when you have a leg length discrepancy, you have a functional scoliosis, and afterward, when you correct it, the pelvis is level and it improves. So there are a variety of causes of leg length discrepancy listed here. And my task here in this lecture is really to talk about traumatic growth arrest. And I kind of expanded it a little bit, not just traumatic growth arrest, but just growth arrest in general. It's one of the list of etiologies that causes the problems. So here's an example. This is, you've seen this now a few times, this concept of a distal femur deformity. This person has a valgus deformity of the leg. The deformity is coming from the distal femur, and the shortening is coming from the distal femur. So this is a post-traumatic growth arrest in an adult patient. When you analyze it, it's 11 degrees of deformity. Now, why is it important to fix this? Well, valgus deformity increases the load on the lateral compartment of the knee. And you can see this from research we've done here, that you can see that the force on the lateral side goes up from about 400 to about 1,400 newtons. And so that causes problems over time. Deformity overloads the respective compartment of the knee. We're going to fix this using a concept called reverse rule of thumbs, using blocking screws. You're going to see this over and over again, but this is a very powerful concept and a very powerful technique to correct deformity when using internal lengthening nails. This is another article that we just recently published on using this technique for a series of patients. So here's the concept. You're creating an osteotomy with a very specific intent,